Okay, so we're starting this particular topic with a particular case, okay? And this case is that there is a 41-year-old female, okay? And she is quite in shape, but she gets really nervous the moment that she sees a particular increase in a particular weight, or even on a waist diameter, or any of those measures of her physical features, okay? So she gets really nervous, and what she does is that she does forceful vomiting after each and every meal that she takes. And she's been doing that for over probably 5 to 6 years. And before that also she used to do it, but now she has stopped. And then again, after 5 to 6 years, she had again begin with the vomiting episodes. She goes to a psychiatric patient. First of all, she comes to you and she says that she has a lot of pain in her throat. Also, she every time she's vomiting, there's also blood that she's vomiting with, and she's having a lot of abdominal back pain as well. So you ask the history and you figure out that there is a bulimia nervosa. Now, bulimia nervosa is a condition where people on purpose, okay, out of their own will, cause forceful vomiting. And they cannot take the fact that they're putting on weight, okay? So it's a psychological condition, and you make sure that this patient goes to a psychiatric, and the psychiatric prescribes an SSRI, probably fluoxetine or fluoxamine, any one of those. But the entire discussion was here just because to understand why was the entire bleeding occurring. And the bleeding was occurring because of something called as a Mallory Weiss syndrome. Okay, Mallory Weiss syndrome. And this is not something that's very, let's say, new, and it's not something that requires a lot of concept. That's why it's a very basic topic. What happens is that, let's say if this is the esophagus and here is the stomach, obviously the patient, or the patient could be either one from bulimia, she's suffering from bulimia, or the patient could be a chronic alcoholic. Because of alcoholism, he's having a lot of vomiting. So every time they vomit, what happens is that there is chronic longitudinal laceration or tear, to put it simpler, in the mucosa or submucosa of the esophagus, especially at the LES junction. So there's a lot of tear, and because of the tear, the patient starts having hematemesis, and definitely a lot of back pain as well, okay? And which vessel is usually implicated? The vessel that is involved. The question that actually comes as after the entire clinical vignette, they just ask a simple question, that which vessel is involved that is causing the bleed, okay, which is causing blood to be found on vomiting or hematemesis. So the simple answer is left gastric artery, and that is because we all know that the lower esophageal sphincter has the left gastric artery that's coming, okay? And obviously you have the esophageal artery. The left gastric artery has the esophageal branches that go to the lower part of the esophagus, okay? So that is a very important thing. How do you want to manage? You just the management is usually self-limiting. You ask the patient to stop doing whatever she is doing or whatever he is doing, alcoholism or even the forceful vomiting. Or if the bleeding is yet present, you just cauterize the vessel. Cauterize, okay? Or you could also do an angioembolization, but I think cauterization is relatively way quicker, okay? So that is a very important disorder that's present, okay? Now, another very important disorder that I really wanted to talk about, because we've spoken about the tear, is something called as Boerhaave syndrome. And what happens here is that there is a spontaneous rupture of the esophagus, and there's a full thickness rupture. That means all the layers are involved, usually, okay? And what happens is that because of that, a lot of the food substance leaks, and along with food we usually inhale a lot of gas as well. So the inhaled gas is also leaking from this particular rupture at the esophagus. It could be due to a lot of condition. It could be because of a foreign body as well. Let's say there's a foreign body, or if there is a trauma, a direct trauma, or even if there is some endoscopic damage. You never know. So, however, endoscopic damage is very rare. but yes, it could occur. So once the gas enters into the thorax, it causes something called as a pneumomediastinum. Pneumomediastinum. And what happens is that there is a subcutaneous, so let's say if this is the neck of the patient, there is a subcutaneous bubble, a subcutaneous emphysema. Okay, a subcutaneous emphysema that's present around the neck region of the patient, neck or chest wall. And what happens is that whenever you press the bubble, there is crackling sounds that is heard. Okay, and this is something that's very interesting, because this is one in a million kind of a case where your esophagus is actually ruptured to that extent that you can actually see a subcutaneous emphysema near the neck. So these are the two important tears: Mallory Weiss syndrome and Boerhaave syndrome. Okay, Boerhaave, I think we've covered most of the everything of Boerhaave as well, and that's about it. Thank you very much.